Next question, the member for York South Weston.
Thank you, Mr. Speaker. My question is to the Premier. Residents of York South Weston have been waiting months for a COVID testing assessment centre and are extremely frustrated with the lack of availability and delays. My office is hearing from many residents like Molly Lynn, Robin Marano and Tanya, who have waited over 14 days to receive COVID-19 test results. Toronto Public Health confirmed that my community is disproportionately affected by the virus and suffers from lack of testing. What exactly is this government going to do immediately to ratify this dangerous failure?
Minister of Health.
Thank you, Speaker, and thank you very much to the member for the question. We have increased our testing services across the province. We are putting $1 billion into testing, into contact tracing, and making sure that people can be in quarantine if they need to be for 14 days if that's necessary. We have opened up over 150 assessment centres. We've also expanded into pharmacies for people who are asymptomatic, and we're constantly looking at other areas where we need to increase our resources. If there is a need, and it sounds as if there is in your community, that is probably an area where we should be opening up more either pop-up assessments or more testing in pharmacies, depending on what the requirements are if people are symptomatic. Of course, they need to go to an assessment centre or another centre of its like. So we are going into communities where there is need. I've taken note of the response and the need in your community, and we will do whatever we can to get the resources there to be of assistance to your constituents.
The supplementary question.
Thank you. My question again is to the Premier. Sydney Ferrero went to York South Weston's new facility that the day it opened. She is a personal caregiver for her mother-in-law living in long-term care. She is still waiting her test results to comply with the home's policy, and that was September 28. She now is unable to care for her mother-in-law and provide the support and comfort she deserves. Mr. Speaker, when a negative test result is for caregivers are required every 2 weeks, those results are not timely and, in fact, out of date. When they finally arrive, what does the Premier have to say to Sydney and her family, who says, and I quote, "I am disgusted and saddened that this has happened. I now face the chance of losing another loved one without being able to see her."
Minister of Health.
Thank you. Well, in fact, what has happened is we've increased our testing capabilities. We've also improved our lab testing facilities. There was a period of time where there was a backlog, but that has been covered. We are now at a point where we are able to do the tests within the required time frame and to get those test results back out to people in a timely manner. So in the case of the person that you just indicated, I'd be happy to look into why they've been waiting for so long for the test results, but over 90% of our public health facilities are able to receive the tests within 24 to 48 hours of the test being administered. So that is something that I'm happy to look at in your situation, but it certainly is not the case across the province because we have greatly amplified our lab facilities as well as our test facilities to make sure that they can respond in a timely manner.